there, welcome back to the Medcurity podcast. Today we are unpacking one of the most anticipated cybersecurity reports of the year, the 2025 Verizon Data Breach Investigations Report, or DBIR. And if that sounds a little dry, don't worry, we're not just reading the numbers, we're talking about what these findings actually mean for healthcare teams trying to stay secure, compliant, and one step ahead. So let's start with a stat that could catch your attention right away. Ransomware was involved in 44% of all breaches this past year. That's up 37% from 2024. And if you're in a small or mid-sized healthcare organization, it gets worse. 88% of breaches among SMBs involved ransomware. So what does that mean? First, ransomware is no longer the outlier. It is the default mode of attack. And while the median ransom payment dropped to $115,000, that doesn't mean that it's less of a problem. It means that it's happening more often at a wider scale. Attackers are choosing volume, and for healthcare, that's a serious threat because even a short disruption can impact care delivery. If you're wondering how this lines up with what you are seeing internally, ask, how prepared are we if someone locks up our systems tomorrow? Do we have backups that are actually usable? Is our staff trained to recognize the early signs? Have we done a real-world recovery drill recently? Let's pivot to third-party breaches. The report shows that 30% of breaches involved a third party, double what we saw last year. That includes vendors, cloud service providers, outsourced billing companies, basically anyone who touches your systems or your data. And for healthcare, that is a long list. Here's the tough part. Even if a vendor gets hit, your organization is still on the hook if PHI is exposed. OCR won't care who clicked what, they're going to care about whether you had the right agreements in place, whether the vendor was vetted, and whether you could prove you tried to protect that data. So ask yourself, when's the last time we reviewed our business associate agreements? Are we auditing vendors regularly, or are we just hoping that they have good controls? These are conversations that can't wait until after something goes wrong. Now, stolen credentials. These were the common entry point in breaches, used in 22% of incidents. No surprise here. Passwords are still the weakest link, and attackers have gotten smarter about getting them. Phishing remains a top tactic, but there is a rising threat here. It's MFA fatigue, and you've probably seen this. An attacker floods someone with multi-factor authentication requests until they just tap approve to make it stop. It sounds almost silly, but it actually works. So if you're only using push notifications for MFA, it might be time to look at alternatives like physical tokens, number matching, or phishing-resistant methods, and make sure that your staff understands why denying those requests matters. Education here isn't something that's nice to have, it is actually your frontline defense. Let's talk about patching next. The report found that exploited vulnerabilities were up 34% year over year, and on average, organizations delayed patching by 55 days. That's nearly 2 months of exposure from the moment a vulnerability becomes known. Now think about that in a healthcare setting, where legacy systems are common and patching can be complex. Delays might happen for understandable reasons, compatibility, testing, downtime restrictions, but attackers aren't waiting for your maintenance window. If it's exploitable, it's already being scanned for. One fix, create a tiered response system. Not every patch needs to be fast-tracked, but the critical ones do. Make sure that the team knows which updates go on the emergency list and which ones can wait, and track it so that you know, not just guess, that those priorities are being followed. Now this one's big. 60% of breaches had a human element. We're talking about everything from basic mistakes to social engineering, phishing, pretexting, the whole spectrum. Pretexting is especially insidious. It's when attackers impersonate someone with authority, an executive, a patient, an IT administrator, and they convince staff to hand over credentials or data. These scams are becoming more believable and faster thanks to AI-generated voice and text. That brings us to a growing concern in the report: AI misuse and shadow IT. 15% of employees used generative AI tools on work devices, and often through their personal accounts. That's a problem. Not because Gen AI is bad, but because these tools can inadvertently leak sensitive information, especially when they're used without oversight. So here's your practical takeaway. Write a policy, not to ban AI entirely, but to clarify when and how it is appropriate. If someone wants to use it to write documentation, great, but make sure they're not pasting in real patient info, and keep a list of approved tools and accounts. let's zoom in on the healthcare-specific concerns. According to the report, healthcare continues to be one of the most targeted industries, especially for ransomware. Now, that's not surprising. The combination of sensitive data and the urgent operations make healthcare an ideal target. But what's frustrating is that many of the same vulnerabilities keep showing up. Slow patching, legacy systems, unclear access controls. In fact, one of the biggest HIPAA enforcement trends right now is around the right of access, patients not getting their records in time. That's not just a compliance issue, it reflects the same underlying weakness. Fragmented systems, disorganized data, and poor process visibility. Fixing access workflows can actually improve your breach posture too. Now, one thing that stands out is how fast attackers are moving once they get in. We're seeing less downtime between the initial breach and what comes next, whether that's accessing sensitive systems or spreading across that network. The gap is getting smaller, and that's a problem. It means you can't just rely on prevention. You need solid detection in place and a team that knows how to respond quickly when something looks off. Tools help, but so does practice. If you haven't run a response drill in a while, now is a good time, because once something slips through, every minute counts. Now let's wrap up with some action steps. Ransomware is everywhere, so make sure your backups are solid, tested, and your team knows what to do. Third-party risk is rising fast, so don't wait to check in on your vendors and update those agreements. Credentials are still a top entry point, which means it's time to go beyond basic MFA and train people on social engineering. Make sure to have clear, workable processes for prioritizing updates, and because human error is behind so many breaches, policies and training matter more than ever. Lastly, AI tools and shadow IT are showing up in more places than you think. If you don't have guidelines yet, now is the time, because waiting usually makes cleanup harder. Healthcare isn't just under attack, it's under a magnifying glass. Regulators, attackers, and even patients are watching how organizations handle data. The good news, you don't need a massive budget to improve your security posture. Most of what we've talked about today comes down to awareness, planning, and consistency. Start with your security risk analysis. If you haven't updated it recently, now is the time. Use it to find the gaps and then act on them, whether that's tightening vendor oversight, patching faster, or giving your staff better training. All right, that's it for this episode of the Medcurity podcast. If you want help figuring out where to start or how to address all these risks we've discussed today, reach out to our team and we will make it simple. Thanks for listening, and until next time, keep your data safe, your systems patched, and your access locked down tight.